Top Biden health officials were grilled by lawmakers for hours on Capitol Hill yesterday over the frustrating state of the pandemic. In one very blunt assessment, the acting head of the FDA said most people are going to get the virus.
Most people are going to get COVID. All right, and what we need to do is make sure the hospitals can still function.
Omicron, with its extraordinary, unprecedented degree of efficiency of transmissibility, will ultimately find just about everybody. Unfortunately, those who are still unvaccinated are going to get the brunt of the severe aspect of this.
This is the first time that these health officials have testified in front of lawmakers since the emergence of the Omicron variant and, of course, the concerns over this nationwide shortage of rapid testing. So for more on this, I want to bring in Dr. Abdul ElSayed for joining us this morning on all of these hours of testimony that happened yesterday. And Doctor, first, I just want to get your reaction to hearing the acting commissioner at the FDA say most people are going to get COVID, because I think that is something that everyone has kind of recognized since the Omicron variant came out, and as contagious as it is, but to hear it in a testimony from a top federal health official is still pretty stunning.
It was quite stunning, and I was actually a bit perplexed about what she said it based on, and frankly why she said it, because in the end, I've been struggling since she said it to look for empirical modeling that backs that claim. And even if there was an empirical model, you would expect a rollout saying, look, here's what we found based on so-and-so modeling. That's how science communication works. But to say it off the cuff like that was a bit defeating. The second point is that the second thing she ended up saying was that we need to figure out how to maintain our structural systems, our institutions, our society, while this happens. But the best way to do that is that people take steps to protect themselves from Omicron. But if they think that it's an inevitability, that most people are going to get it, then in some respects it sort of destroys the incentive to do what you can to protect yourself. So it was stunning and also somewhat perplexing as a means of science communication here.
Look, she said it, and then Dr. Fauci sort of backed it up, saying Omicron's going to find just about everyone. And if that is the feeling within the administration, then I think, as you say, Dr. Sayed, you have to present a different outline for how the country will respond, correct?
That's right. I mean, and there was a bit of a difference between what Dr. Woodcock said and what Dr. Fauci said. You know, finding someone to me means you're going to get exposed. And I think, you know, our lived experience is justifying that. Everywhere you turn, there's someone who's popping positive, but doesn't mean that you're going to get it. In fact, the evidence from the UK shows that people who've been recently boosted are about 75% protected from being infected. And so, yes, there are things that you can do to protect yourself. This is not an inevitability. And so I was a little bit just confused. And yes, like we do need an outline about exactly what's going on here to protect ourselves. Things like N95s, things like rapid antigen testing. These are tools that people can use, yes, to protect themselves from this thing. It is not just an inevitability.
Joining me now is the chair of UC San Francisco's Department of Medicine, Dr. Robert Wachter. Dr. Wachter, thanks so much for joining us this morning. And I mean, those comments from Dr. Janet Woodcock, the acting commissioner of the FDA, it seems like that's what a lot of people have been saying since the Omicron surge around Thanksgiving when we first learned about this new variant. But to hear a top federal health official put it so plainly was really striking.
Yeah, I am struck by that too. It's clear that it's spreading like wildfire, and all of us know friends and family who have it. Whether all of us are going to get it or virtually all of us, that seems a little hyperbolic to me. The numbers say about 1% of people a day are getting it. So a lot of people are going to get it, but I still am not of the attitude that it's inevitable you're going to get it. And the signs are that it's going to peak relatively quickly and come down quickly. So to me, the right call is to be careful for the next few weeks until this hurricane passes.
Is there a concern hearing comments like that from Dr. Woodcock that maybe it'll encourage people to not follow the guidance as much, to not mask up as much, to not hesitate from doing as many public or group activities as they had been, given, you know, if you have this mentality of, well, I'm going to get it anyway, it's inevitable. How does that affect people's behavior, you think?
Yeah, I think that would be my that would be my concern. My concern is that it is very infectious. There's a decent chance if you're out and about you are going to get it, but it seems likelier than not that we need to be careful for probably the next month. It's already peaking in New York. It's peaking in Washington, D.C. There's some evidence that it's peaking in Boston. And the rest of the country likely will peak in a couple of weeks and then come down over the next few weeks after that. And so I'm still in be careful. This is a time where don't take unnecessary risks. And in part because I think when we get to February, we'll probably be in a pretty good place. So many people are going to get it that even the unvaccinated, virtually all of them, will have some measure of immunity they should have gotten from a vaccine, but now they'll get it from the virus, assuming they don't succumb to it. And so I think we will find ourselves in a good place. And I don't think the right call is just to say it's inevitable and to throw your hands up at this point.
Yeah, and Dr. Fauci seemed to draw more of a distinction, saying that everyone could at least be exposed to it. Of course, that's not the same as actually getting infected. But I do wonder what you also made about the testing plan from the administration. Of course, this has been a nationwide shortage of rapid tests. It is very difficult to easily get your hands on one, but there's this plan from the White House to distribute $500 million for free to people who sign up on a website. But of course, that website's not yet available. And we heard a health official say yesterday they've secured about 50 million of the tests. They're still working on getting the rest of them, and they think it could be about 60 days over the next 60 days that you actually see those tests distributed. So I'm wondering what you make of that timeline.
Yeah, Caitlin, it's good. We need the tests. People are using the tests to try to figure out whether they're infected and to figure out when they can come out of isolation. But it's a little bit too late. I think the likeliest thing is that all of a sudden we're going to have a lot of tests around about 2, 3, 4 weeks after we really needed them. We need them now. I found my son got COVID about 5 days ago, and I scrounged around San Francisco to try to find a test, went to 3 pharmacies, couldn't find any, tried to sign up for a PCR. That was 5 days away. It's not useful. And so we really need it now. Now, we will need it later too, so that's good, but they should have been working on this months ago.
And so what's your advice to people who are in that situation? Because I've heard the same thing. It's hard to get a rapid test. You can't find one. You try to schedule one. It's several days before you can actually get an appointment. And so what should people be doing if they're worried that they are infected in that period?
Yeah, you're in a sticky situation if you have symptoms that can be COVID, and the problem is they're pretty almost everything. A fever, a sore throat, a cough, any of those things. At this point, the disease is so prevalent, so many people have it, that I think the right assumption is that you have it until you can get tested. And once you make that assumption, what you should do is isolate yourself and stay home, don't come in contact with other people, and wait until you can get a test to confirm that. And so, it's a tough situation, but I don't think there's any way to be sure whether you have COVID if you have compatible symptoms and when it's as prevalent as it is. The best estimates, even here in San Francisco, which is a highly vaccinated city, is right now about 1 in 10 people walking around the street have it. And our test positivity rate for people that have symptoms is about 40%. So there is a pretty good chance that you have it if you have any compatible symptoms. You have to act as if you do.
Good advice, Dr. Robert Wachter. Hopefully this testing situation will be resolved soon. Thank you so much for joining us this morning.
My pleasure.